Good morning, Dr. Ravi. Are you there?
Yes, ma'am.
I'm sorry. I was just confused with 9:30 with the timings over here. So just give me 5 minutes and then we can admit other people and we can start, if that's okay. Uh, do you want to let me just give you this thing, permission to share so that you can share your slides as well. I'm keeping my camera off, just not feeling well, so that's why. Just give
Okay, no issue, ma'am.
Just give me a minute and then we can start. In the meanwhile, let me
Shall
admit.
I share the PPT before on the presentation?
No, no, no. So uh, when you'll start the presentation, I've given you the permission. You can share the slides.
Sure, 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 ma'am.
Just give me a minute and then we can start. Hello, all. We are here again with our channel club meeting for the month of January. We have our speaker, Dr. Ravi Dalia. He's an associate professor in HOD department of Agatantra. He has an teaching experience of 7 years in department of Agatantra as a part of PG coordinator and member in PD studies committee in college. He's a member of research committee in college. So I would like to invite him and welcome him for this first general club meeting. Dr. Dalia, you can take the stage on and you can share your slide and you can start presenting. Thank you.
Is it okay with ma'am? The voice is
Yes, yes,
audible?
it is good. It is good. It is audible.
Is okay with the screen also? I don't know why the camera has been tilted.
Yeah, but I cannot see your camera is
PPT.
fine. We are able to see. I can't
Sure,
see
ma'am.
your presentation. So when you go on that slideshow top on the top, close to that animation, there's a
Is it okay, ma'am?
yes, it is. Just call me Archana.
Just give me a minute. Yeah.
Yeah, take your time.
Can I start, ma'am?
Sure, sure, you can.
Okay, ma'am. So thank you so much for inviting, and thanks to the GCR even and Dr. And especially thanks to Dr. Pratibha, ma'am. I have met her before also, and suddenly she invited me for to present something on your platform. So today's, as we are here for journal club meeting, we all know that why we do the journal clubs. So it is basically for to read the articles which have been published. We will see the strength of that articles and even we see the critical part of the study. that what the author has done and what can be done, so that even for the future, people also can learn that yes, this is something which is missing in the article, and when we are planning, so definitely we include those things which are missed by the author. So today's topic was, as I have also been done my PhD in fatty liver diseases, but it was an animal study. So I have choose that study only. So topic is evaluation of Ayurvedic interventions in non-alcoholic fatty liver disease. It's a silent disease. And myself, Dr. Ravi Dhalia, and BMS MD and PhD, now working as associate professor and HOD, Department of Agatantra at Babeke, which is in Punjab. So moving forward, before the presentation, I wanted to declare that this present is only for the academic purpose to learn something. And I don't want to criticize any investigator or any personnel connected to manuscript or clinical study. And the views expressed here with our sole purpose to be only for the academic, and the presenter declares no conflict of the interest. So today's presentation is this is the what we going for further is that I will uh, tell you about what is NAFLD, which is non-alcoholic fatty liver disease at the metabolic. It's a metabolic crisis globally and as well as in India, and we'll see that what is how NFLD is definition and how pathophysiology it is. So we will learn that what is NFLD and the reverse pharmacology approach in Ayurveda. And I have in this particular presentation, I have took one is study for the protocol, that the study is only a protocol. They have not done any study, but they have very well furnished protocol they have mentioned, and it has been published in a very good journal. And three will be the clinical study. In that, we will learn about the methodology, objectives, inclusion and exclusion criteria, assessment parameters, dietary lifestyles, advices, and results. And then last, we will see what was the critical analysis over that. And then last of the presentation today, we'll see some of the takeaway messages from the present presentations. So these are the four articles I will see and will learn from today's presentation. One is Phalatrikadi Ghan. It's a very basic study, and I just wanted to start with the very basic study, and we'll move forward with the advanced study. Second one is the very good study which has been planned, and it is a exploratory kind of a pilot study, and it is again a protocol study. It has not been done in the patients yet, but they have prepared a control in a very furnished way, and they have published in a very good journal which is under the CCRS. Third one is it's a very good study which is been PubMed published, and I have not seen such kind of a study which has been published in a PubMed, because there are very few studies over the Ayurvedic drugs in a non-alcoholic fatty liver disease. You will see many of the case studies, single state studies, and many of the journals are not even a good journals. So I have only taken one study which has been published and which is published in the PubMed. And the last one study is not related to properly with the Ayurveda, but the drug which has been mentioned by them is an Bhumi Amelki, which is again an Ayurvedic herb, which is very potent for this for liver diseases. And we'll see. Just I have mentioned this article because we so that we can learn from that article the how they have prepared the article, what was the methodology have they followed, so that we can publish our articles in that way, so that we can go with the international levels, because this study has been published in BMC. We all know that is one of the best journals for published the articles. Now coming to the scenario around the world is that approximately 25 to 30% of general public is been affected with NAFLD, and there's definitely a shift from NAFLD is a first stage, and then that if we not been treated, they can lead to a chronic liver diseases. And now that's this kind of a study, this kind of a disease is been overtaking to other very acute conditions like hepatitis B and C. So they are overtaking these such acute conditions even. And economically, we see the globally in the USA, and this focused uh, category is $100 billion industry. So I'm not going in deep that how they are doing it with. Next is that with that NaFLD, if it's not been treated, it go to the progressive stage, which we called as NASH, which is a steatohepatitis. And after that, if it again not been treated, it can lead to again a very serious condition. We call it as cirrhosis or hepatocellular carcinoma. So you can learn that NAFLD is a reversible condition. If it not been treated, it can go to a very dangerous conditions can lead to. Indian scenario, yes, even in India, it is from 9% to 32% people are being affecting. And it is mostly seen in urban areas because rural areas we don't have much of investigations and much of good hospitals there. And in India, we call this as a lean NaFLD. What is lean NaFLD is that even the but as we see that NaFLD is linked with the obesity kind of a conditions. If you have diabetes, obesity, and then it will definitely with the you will may suffer with the NaFLD. But in India, you will see that most of the people are with the normal BMI. They are not obese. They are normal BMI. Still, they can have an FLD with that. So that is why we call it as the lean FFDL phenomena, which is seen in an Indian population. Now, root cause is we will study further also that it is a high visceral fat which is deposited into abdominal fat, and with the insulin resistance even in the non-obese individuals. So this was the reason behind why they have called the lean NAFLD. Comorbidities, yes, we all know that type 2 diabetes and other metabolic conditions are linked with the NAFLD. So we are more focused into diabetes, but we'll never see that whether the patient is having a fatty liver or not. And we see, yes, normally we see, yes, because you have a diabetes, definitely you will have it. So
Dr. Dalia, your screen paused. Hello? Dr. Dalia, your screen paused.
yes, ma'am. Sorry for the interruption, ma'am.
That's okay.
Actually, my Wi-Fi was not working.
That's okay. That's
I was
okay.
in
No, no, that's
village
fine.
areas.
That's fine. That's fine. That's fine.
Hello. Now it is working, ma'am.
Can hear you. Yeah, we can see the screen as
Can
well.
you tell me, ma'am, which slide was I was on?
You were
Sixth or
on an
seventh?
I
This
can you just
slide?
maximize? Yeah, this one. No, the one
This
before.
one, no?
Yeah, yeah, yeah.
Oh, this one, no?
Yeah.
Yes. So I was talking about what is NAFLD. So it is nothing but the excessive fat in the liver cells and not related with the alcohol. So that is why we call it as non-alcoholic fatty liver disease because it is not due to. There's another condition where from the alcohol only they will get the fatty liver disease, but we are talking about non-alcoholic fatty liver disease. And after that, also same with the alcoholic fatty liver disease, it goes to the NaCH condition, cirrhosis, fibrosis. Same with the NAFLD also, if it has not been treated, it can go to the progressive condition stage, which is called as NaCH and the cirrhosis or fibrosis. When we look into the cause and risk, yes, we all see that I have already told that obesity, type 2 diabetes, hypertension, even the unhealthy diet. We all see why it has been increasing because of the unhealthy diet, processed diet, which has been available for even the 16-year of age getting the non-alcoholic fatty liver disease because of the unhealthy diet. And due to that, you will lead to obesity and then to the diabetic, and definitely it is correlated with the NAFLD. So symptoms, you will shock that most of the symptoms are patients are asymptomatic. You will not see any symptom, and patient never come with any kind of a symptom that they have a fatty liver disease. That is why we call it as a silent crisis, silent disease it is. Now, when you go further, you will see some of the basic symptoms. You see that fatigue, abdominal pain, sometimes even nausea, or such kind of symptoms may can be seen. And diagnosis is dependent only on ultrasound.
Hi, Dr. Dalia. I'm sorry you're having internet issues due to the weather. Uh,
Yes, ma'am. It is not a good weather here. We have a rainy season here also, unexpectedly from today.
do you
So
think
can I
you want to
restart
reschedule
again?
to tomorrow, or like you will be able to do it
No,
today?
man, it will be easy. I don't get it to again frustrated to for tomorrow. I think I have just on my this mobile network actually.
Okay. Okay. Yeah,
I
we
hope
can
it will
see.
be
Yeah, yeah,
good.
yeah. Uh-huh.
So start now, ma'am.
Yes, please. Thank you.
Yes, so I was talking about that. Yes, there's no FDA approved treatment. So there's an open gateway for the Ayurvedic doctors that we will should focus for more of the researches so that the industry will get some kind of a good Ayurvedic treatments. Now coming to the more of the clinical side, yes, 60 to 80% are always been asymptomatic, and incidentally it always been incidentally diagnosed, and mostly during the routine ultrasound. So during the health checkups, we'll see instantly diagnosed with the. So incidentally, we diagnose with this condition through these routinely, not routinely, but with the unroutinely diagnosed, like with through the health checkups, or sometimes we'll get some of the elevated liver enzymes. Next is when we go suddenly for the ultrasound, we will see the enlargement of the liver. And through that, we can see, yes, patient may get NAFLD, non-alcoholic fatty liver disease. And then the patient will go for the further blood tests or other tests to confirm it. Next is biochemical abnormalities. Yes, we go for ALT and ASG and other ALP test, and we will see that even for the NAFLD, if it is in the ultrasound or fibroscan, but even the biochemical liver enzymes can be in the normal range. So the normal liver enzymes do not exclude the NAFLD. So we need advanced investigation whenever we see or doubtful that patient has a NAFLD. Metabolic conditions like if it patient is obese, type 2 mellitus, dyslipidemia, hypertension. So we will definitely see and tell the patient that you might have NAFLD. And if it has not been treated, it can go to a progressive stage. That is, we call it as NASH and fibrosis. NACH, nothing but the worsening of fatigue conditions. And then you will see the persistent transaminase elevation of the blood cells of LFTs and ALP. And other with that, inflammatory markers like CRP and other markers can also be seen elevated. When it goes to fibrosis, you will see the patient will have the portal hypertension features like splenomegaly. You will see the ultrasound and blood level. You will see the thrombocytopenia. And ultrasound, you will see might be ascites in a late conditions, jaundice in an early stage, and variceal bleeding like the esophagus. Will see patient will have a bleeding, vomiting with that. So we'll see that yes, it is now go to the cirrhosis. Now, coming to the Ayurvedic perspective, so there is a no direct mention of NAFLD kind of entity in Ayurveda. But if we go for etiology, pathogenesis of NAFLD, yes, there's something which has been mentioned in Ayurveda, like Agni Vikrati or Medorogas. Medorogas, nothing but the fat metabolism. If it has been disturbed, we call it as Medorogas. And and when we see the etiological factors like unhealthy diet or something like when patient is not moving, they have no gym, no exercise they are doing, and their sitting jobs will be there. So we will again correlate with this Santarpanjanya Vyadhis. And again in Santarpanjanya Vyadhis are again lead to the Medorogas and and how it starts. Like first, you will have a overnutrition and other etiologic factors, nidanas. You will see the Agnivikriti first, and then due to Agnivikriti, there will be a vitiation of kapha and meda because of you have a diet of kapha kind of a diet if you are taking. There will be Agnivikriti, and due to that you have already taken the kapha kind of a inducing kind of a ahar with in the diet. So you will see the vitiation of kapha and meda first. And when the vitiation of kapha and meda will be there, we all know that it will block the channels in our body, which we call it as strotarodha. And due to that, they will be, because the channels are not clear, then the undiagnosed or maybe the undigested metabolic parameter entity be deposited on superficial. And that leads to again a condition like NAFLD. And then so, and again, when it comes to after that, when there is a strota avrodh, there will be a blockage to the vata even. And if vata is vitiated along with the kapha and meda, so it leads to more of a worsening condition for NAFLD, and the cycle repeatedly go and go. So we'll see that in all the pathology, we see that Meda is one of the prime factor in pathogenesis of NAFLD. And definitely it can be reverted to normal state if we follow strictly with the diet and lifestyle. And ahar and vihar, even the diet, interventions with Tiktarasa and Rukshunas herbs and Pathya diet and Vihar for to convert and to reverse such condition. So my first study, which I have mentioned here, is the study efficacy of Phalatrikadi Quath in the management of non-alcoholic fatty liver. And why Phalatrikadi Quath? Because it is a Chakradat mentioned this same Quath for the liver conditions. So the author has taken that same formulation for to study. And this study is done in Department of Kai Chikitsa, which is a government Ayurvedic college in Assam, and it's recently published in July 2024. This is the journal name, Journal of Emerging Technologies and Innovative Research. This is a formulation. It has 8 drugs in it. And when you see the Ayurvedic pharmacodynamics, more into Tikta, they have more into the bitter taste it has, and then the Kashaya taste it has. And coming to the Virya potency, it is a kind of an Ushna drug. And when we will see the Rasaguna Virya, we will see that it is action on dosha will be the Kapha Pit Shamak. So it will reduce the Kapha and Pitta body. And when it goes to the Dushya kind of things, we'll see that yes, they will directly work on Meda and Rakta. So in this, all these herbs, there are three very important herbs I wanted to mention. Is one is Kutki, which is we all practitioners, we all know that Kutki is in clinical practice. We lot of practitioners use Kutki, Guduchi, and Trifla for liver and gut axis kind of conditions. And in this formulation, it has all the three. So it is a very good formulation for such conditions when you have FELD, and it counteracts the kapha and mega over Yekrit. Methodology has mentioned that the study has been. Hello, ma'am.
Hello.
Can you? Am I
Yeah,
audible, ma'am?
you are, but you're breaking a lot in between. So just wanted to let you know.
Can you will freely to interrupt me. You don't see that I'm not audible,
No,
so
no,
that
you're
I
audible.
can
You're audible. You're
exchange
audible.
with the other 2 3 bypass.
No, no, we can hear you. It's just that you're
I
breaking in
have
between.
okay, sure, ma'am. So one man, if you wanted to this want to upload to YouTube, you start it in between so that it will not be corrupted on YouTube.
It will be because this is the recording I'll be uploading.
Yes, ma'am. I want you to please cut the parts.
Yeah, I'll try.
Ma'am, is it? Am I audible, ma'am?
Yes, you are.
Thank you so much, ma'am, for
No, no, don't
helping.
worry. No, no, please don't worry.
Okay, I will continue from this, ma'am. I have finished. I think I have done with this PPT, this slide, ma'am.
Yes, you have explained this. I think
Okay,
you
thank
were
you so
on
much.
that Kapha Pitta Shamak and various ocean
Okay.
still there.
So
Yeah.
yes, so we have a three herbs in it: Kutki, Gaduchi, and Trifla. We have, as a practitioner, we all know that these are very potent drugs, and this formulation particularly has all the three herbs in it. And yes, it directly counteract the kleda, kapha, and as well as the meda on liver. So it is very potent formulation. When it comes to the methodology, yes, the author has mentioned that it is randomized, but as a single arm clinical study. So they have not divided the patient into a two groups or three groups. So there was only a one group, and in it they have, but in the article only they have not mentioned that how they have been randomized, that how they have been screened. Next is that sample was 60. Intervention was again a Phalatrikadi Quath only. Dose and duration, they have taken 40 ml twice daily with the lukewarm water after the food. And the trial drug was given for a period of 3 months. And the follow up the patient was done every 1 month and asked to continue the medicine. Regarding to the diet, it was been advised as a low fat diet, avoid deep fried foods and red meat. So coming to the inclusion exclusion criteria, yes, they have mentioned about the patient age, like 18 to 70 years will be the ideal for this study. And with that, the subject should have complaint of indigestion, pain, abdominal, anorexia, fatigue, nausea, and fulfilling the criteria of diagnosis. So they will include those kind of a patient. And coming to the exclusion, below the 18 or above the 870, they will not take. Pregnancy and lactation with severe cardiac disorders, psychiatric disorders, stomach ulcer, cancer patients, surgical intervention, they will exclude from the study. But very interestingly, I wanted to tell you that they in the screening part also they have not mentioned that how the patients were being screened and on what parameters they've been screened, because we have already been studied that diabetes and other dyslipidemia or other kind of obesity, such kind of comorbidities should is always been there with the patient. So if you are taking the patients for your study, you should mention that in or either into the inclusion criteria or into the exclusion. Like simple diabetic patient is there, he's on the medication, and then you are including in the study, or you can do it like you can directly exclude those patients from your study, but they have not mentioned such kind of thing. And when coming to the assessment parameters, and subjectively, they have mentioned about anorexia, indigestion, nausea, bloating, and pain abdomen, and they have categorized into, and they will see through the grading system so that patient will lie which grade they have this kind of a symptom. And coming to the objective parameter, they have done with the USG, and they will take the patient either with the stage 1 or to the stage 2. Coming to the other parameters like hematologically, basic test was there, CBC, LFT, and other things, and with the lipid profile. Now, coming to the results, you can see that there is a before and after treatment result. You can see that in an anorexia, in a subjective parameter, you will see that there is a vast difference from before and after. And they have mentioned it as all the parameters and all the sign and symptoms they have mentioned in the table as highly significant. And in other parameters, objectively on blood and even the USG, you will see on the table they have mentioned about the p value as well as they have mentioned that there is a highly significant. So my question is here is that each parameters they have mentioned the highly significant. How it can be possible that in 100% relief is a rare in clinical trials? And if you see the good journals article, you will see there's definitely they will write the negative part also in the study that yes, we don't get the result in LFT or something like that, but 100% relief is an a big biased about this in this article. Now coming to the discussion part, they have completely have introductory part they have mentioned. But my question is again that they have why they have not discussed about that result, what they have gone through, and Why the result it was highly significant, they whether they should have that if we see that yes, if they got that good result, so they should discuss about it with the previous research articles even, so that it will give the more of the weightage to the article. So in anywhere discussion they have not mentioned anything about the study. And coming to the conclusion part, they have highlighted the drugs what they have used and that significant result they have got. And further, there's no adverse effect was observed in the patient. But I have not somewhere anywhere I have read that how they have seen that no adverse effect was there, which kind of a ADR they have followed, and what kind of done, like how they have observed those things. So they have not mentioned where they have done that no patient has got the adverse effect. So critical analysis of my is that Quatha is hydroalcoholic mostly. So whether the water soluble glycoside, if we see from the modern side, that concentrated part is more potent. We'll see that Kutkoside or from the Kutkase more into the concentrated form. So why not Ghanvati we can try? Why always we give the patient to the Quath form? And now the companies are coming with the Ghanvatis also, and even the practitioners, even the very good practitioners coming with the Ghanvati. So why we should study one cause? We should go for the Ghanvati studies now. And duration is like they have mentioned that 3 months week was the duration of the study, but now it is not at all enough for the chronic metabolic condition and NAFLD. But in the result, they have mentioned that they got the highly significant result even in the USG. Now, coming to the Pathya, they have not mentioned any guidelines of the dietary, what kind of a food, which type of a fruit, which type of the pulse they should follow, or which type of a things they should not do. And even from the exercise part, they have not mentioned any kind of a yoga, which kind of a yoga the patient should go, or exercise, and how many times they will do in a week or in a day, or how much time period should be there, whether it should be in half an hour or maybe the 45 minutes. They have not mentioned anything kind of such things. And it is a single arm. And strengthly, if we see the positive side, is single arm is very easy. As we if we are into the clinical part, we sit into the clinic and small hospitals, so single arm is okay. But when we wanted to claim the study, we should go with the multiple things, like multi-centered. There should be a double blind, and RCT should be there. So no placebo or standard drug used. So it will not give the full proof of that whether the drug has been working or not. And the article should be written in a better way. They have very vague things of mention, and discussion was not properly prepared. They should have mentioned the previous studies published, as already told you, why this formulation has been taken. They has not mentioned even that formulation is from Chakradat. So such kind of things was missing in the article. Yes, placebo cannot be claimed if it is there, and if it is placebo is not there, then cannot claim a drug better than a standard care. Results, yes, they have shown that the result was there, the USG changes was seen, but they have not mentioned that a complete reversal. The study is not showed a complete reversal of grade 2 to the normal. They even bifurcated that results into that how many of from a grade 2 came to the grade 1, or how many from the grade 1 came to the normal. So they have not mentioned such thing. And there's no limitation, future scope is also not mentioned. No side effect, already told you that there's no ADR format what they have followed in the study, they have not mentioned. And the another part is very important, that no follow-up mention. Then how can you see that whether the drug is working or not? What happens to the liver markers after the 3 months after stopping the drug? And and that small part is that they should even go for the further few good study, good investigation. Even that fibroscan, it is very easy available nowadays to the even in the rural areas. So the study should include the fibroscan even. And yes, the study should be 6 month follow up, so that it will be critical point to mention, and so that it gives the weightage to the article. Now, second article is that how that efficacy of Ayurvedic intervention with the lifestyle As I already told that previous article, they have not mentioned the lifestyle, but this article have mentioned very deeply about the how the patient should follow and what kind of a things they should follow in the lifestyle, and versus with the lifestyle intervention, that whether the Ayurvedic medicine is working with the lifestyle or alone lifestyle can be worked. So these two things they have mentioned in the methodology, and they have taken grade 1 and grade 2 alcoholic fatty liver disease. So they have made the protocol how we can study, and about the multi-centered studies can be done like this: an exploratory kind of and pilot study and randomized control trial, how we can plan such kind of a study. So we'll see whether how they have done it. And the source was, it's a very good journal of research in Ayurvedic science, which has been again published in 2024. Design was multi-centered. They have proposed it should be a multi-centered exploratory, a pilot randomized control trial, so that it can go for the further big studies. So they wanted to start with the pilot randomized control trial. Sample size was very good. They wanted to take that 90. And typically 60 to 100 patients, if we take, then it will either to the phase 2 or phase 3 trials are considered. Study centered, they have mentioned that this study will be study through the CCRS and as well as the research center of New Delhi, Bhubaneswar, and the New Delhi, the two centers they have mentioned. This is a pilot study, and they will do it. I don't know. I don't find it because it is a 2024 article, but they have. I don't find it any on the Google about the whether further they have done it or not. So, but still, it is a very good article. So I wanted to explain it here. Phase was, obviously it is a very conventional kind of a randomized controlled trial with a phase 2 kind of a stage in clinical trial. Duration was 12 week, and definitely they have mentioned the follow period also. Now coming to the methodology, as I told you, it is a multi-centered exploratory pilot kind of a RCT. And objective was to just to see the therapeutic efficacy and to assess the safety. So that is why they wanted to study in a phase 2 with the pilot study. Step 1, they start with the screening first, and then based on the blood investigation, ECG, USG, and with the fibroscan or with the MR. And second step was after the screening and for the enrollment patient, you will see that then they've been randomized, computerized based. So it is a very good kind, and they have mentioned the site also that where they have done that randomization. And group 1, that is a trial group, and they have mentioned that in this group, the Ayurvedic formulation will be given with the lifestyle modification guideline. Second, it was a control group, and only the lifestyle modification alone will be provided. Step 3, after the 12th week of intervention with periodic monitoring, they will periodically, after 30 days, they will monitor. And then after 120 days, they will study again. So there was a 4 week of a intervention. After that also, there was a follow-up of 4 weeks. So it was a big study they have planned. An intervention, they have mentioned about the Arogya Vardhini Vati and Piplayadi Asa, which is very practitionary. We all aware of these two drugs, and it is we all know that is very practically efficacy about these two drugs, and we all practice about these two drugs to our patients. Now coming to the sample size, and they have mentioned in the article about this very weightigly, they have mentioned how they have done the sample size and statically rationally behind that, how why they wanted to 90 patient only. So I'm not mentioning it here, I just wanted to tell you. So they have taken the 90 participants in this, and in the trial group they have taken after the randomization only 60%, and in control group only 30 patient will be randomized, and there was a ratio of 2:1. And it is a first kind of a study. Even I found it that set with the USG or with the blood investigation, they have mentioned fibroscan and MRI PDFF, which is a very gold standard. Again, is a very gold standard investigation. So this kind of a technology should we also use, and we should also aware of that so that we can plan such kind of a big studies with that. So this was the schedule they have mentioned, that after the screening on these parameters, they will see through the baseline. And after 30 days, they will see again the medical history will they will take medication, rescue medication if needed, ADR they will follow whether the patient is getting ADR or not. And if the patient is getting ADR, they will exclude from the study. They will stop the patient from the study. And then drug compliance, if any of the patient have any kind of a good drug compliance, whether the taste is not good or any kind of a things they are been complaining, again they will be excluded from the study. An issue of the trial drug. So on the baseline, they have given the drug 30 days, 60 days. Every 30 days, they are evaluating the patients. So we'll see that how this beautifully they have mentioned of the schedule of the parameter and assessment. So this was the study flow chart. They have even mentioned that how the clinical examination they will do and how they will randomize the patient, baseline what they will do, after the 30 day what they will do, after the 60 day what will do, and 90 day, and then last the 120th day. So this is how one should study and one should prepare the methodology so that we can go for the good journals. Ayurvedic intervention, they have selected two Ayurvedic treatments. One is Arogya Vardhini Vati with 500 mg tablet. Orally, they will go twicely in a day after the meal for 45 days only. And Pipliyadi Asav 15 ml again for twice time in a day after the meal with water and for the period of 90 days. So this is how they have planned the treatment. And yes, we all know that it is a very good Deepan Pachan drug in it. Yakritu Tejak, it has a Lekhan kind of, and from the individual herbs, which is very good in all the parameters like anti-inflammatory, they have anti-helminthing, immune system they break. So this is kind. So they have a very good selection of the this drug. And we'll see the inclusion and exclusion. This is one should go for like the previous study which I have mentioned, that they have not mentioned such kind of things. So this article they have mentioned everything. Then inclusion 80 to 60% age of patient will be there. USG grade 1 and grade 2 only they will include. And with the hepatic enzymes, only the 2 times upper limit will be taken. And if it 2 times upper, they will not take. Below only they will take from for the inclusion. And willingness to strict lifestyle protocol. They have mentioned in the consent form even that this study will be for 4 months and you have to follow the lifestyle protocol. If they are agree, then only they will take the patient for the study. And when it comes to the exclusion part, alcohol consumption, if they are exceeding to 20 gram per day for a woman and 40 gram for a per day for a man, they will exclude it. If the patient has alcoholic liver disease or cirrhosis, they will exclude it. The patient, if has a medications which is maybe inducing NAFLD, they will exclude it. Comorbidities like uncontrolled diabetes or patient has a renal failure or RFT has been dearranged, so they will exclude it. History, if the patient has a cardiac arrhythmia in the past or in the present, myocardial infarction in the past, acute coronary syndrome, if they have a history, severe arrhythmia, stroke within the last 6 months, they will exclude it. Uncontrolled, even the uncontrolled pulmonary dysfunction also, they want to exclude it from the study. And as pregnancy, lactation, and even the viral markers, if they have present, they will exclude from the study. And beautifully, they have also mentioned the withdrawal criteria, how the patient will be withdrawal from the study. If they are with, they have been included in the study, but at what time period, at what parameter they will be, can be excluded. So they have mentioned that if the patient is failure to adhere the treatment, if the patient is not following, that is why they wanted to screen the patient after 30 and 30 and 30 days. If the patient is above the 80% of compliance, they will withdraw the patient from the study. And if the patient has missed something, missed the drugs, even in missed the lifestyle guidelines, so we again will be excluded. And if the patient has got the adverse event, even any kind of adverse event, even single adverse event, if they got, they will be withdrawal from the study. So this is how they beautifully mention about everything in the study. Now, I was talking about the dietary and lifestyle advices to have mentioned that there should be a brisk walk strictly for 4 months for 30 minutes daily. And along with that, yoga can also be practiced. And they have mentioned some of the asanas also that should be practiced with the 10 minutes. And they have mentioned about do's and don'ts, in which they have mentioned about each and everything about the food and vegetable that perwal, karvelak, papaya they should can take. Legumes like moong dal, kulat, green gram can also be taken by the patient. Even in fruits like dadim, guava, they are focused on such kind of fruits, and they have given the guidelines to the patient. And what they should not eat is also been mentioned very deeply, like avoid packaged foods, spicy foods, strict intake of certain fruits and vegetable, including fruit juice without pulp they should not do. Potatoes they should not take. Cauliflower, broccoli, cabbage, and beans. Now, coming to the assessment technology that they are want to follow that, which is a very good gold standard. One is fibroscan. They wanted to study in this, and MRR PDF, which is nothing but the MRI along with the proton density fat fraction. So it is nothing but the most accurate non-invasive method to quantify the liver fat content in the patient. So this is what's been done even the CRI population. They will do in this institute. And fibroscan is nothing but again it measure the stiffness non-invasively. So these two parameters and standards they have want to take in the study. Now, other parameters, Ayurvedically, they wanted to see the clum, Aruchi, and Gaurav only, and secondary anthropometry like BMI, waist circumference, HbA1c levels, because they wanted to exclude from the study if they have uncontrolled diabetes. Liver function test, lipid profile, USG grading, primarily they will see. And after that, 90th day also, they will see the fatty liver index based on such like LFTs and as well as the USG grading. Limitations, the pilot sample size will not capture rare side effects. So pilot study is always a primary kind of a stage. USG is operator dependent. So fibroscan would be more precise objective measure. That is why they have wanted to see the fibroscan. Future scope, long-term study should be there. They have mentioned it like there should be a 6 to 12 month study should be there. And in conclusion, this protocol paves the way for Ayurveda to be recognized as the first line treatment for metabolic liver disorder. If such kind of study has been done in this methodology way, so definitely we can conquer it as a primary treatment for such kind of a conditions in an industry. Critical analysis, there are very small critical analysis I wanted to mention that when there's a multi-center study, so there may be a biggest challenge because medicine uniformity should be there. The guidelines of dietary and lifestyle maybe can affect by strictly. Strength the shift, yes, they have strict that they wanted to USG grading. After that, they wanted to fibroscan and other things, but it is very again a very good gold standard quantification for hepatic fat quantification. So this makes the data speak the same language as a modern hepatology. So that is why they have mentioned with USG other parameters like fibroscan and MRI. So analysis why, because even the technology is superior, but these tools are very expensive for the patient. You should discuss whether it is make the study protocol difficult to replicate in smaller RD college or not. So they can even mention it that even the small institutes cannot afford such kind of a big the kind of investigations. Duration, yes, even this kind of a study they have mentioned about 12 weeks only, but it is not enough to see the change in fibrosis. So if you wanted to see the fibrosis reversal, they then definitely we go for further long studies. Allocation ratio, I didn't see why they have taken 2:1 ratio. So it was a strategically or with the bias. I've not get the answer from the article. And an exploratory pilot study is this is a smart move and it allows for a deeper safety profile analysis of the herb. So it is a good part. But yes, they can even if they are following 2:1, I will suggest why won't they wanted to go 1:1 ratio. I don't know the what would be the reason behind it. Yes, next one is the lifelike confounder. Yes, we all know that even from modern side of things that lifestyle can reverse NAFLD. We all know that. So lifestyle is a medicine in itself. So the study is designed to show that add-on effect, but can Ayurveda make it more work better or a faster? So this should be focus. I was waiting for the result of that study. So we'll see whether it is again a good study or not when it comes to the result. So we'll see. Now, third article is about a very good journal. PubMed, it has been mentioned, and journal name is Journal of Ayurveda Integrative Medicine. Is the only journal which has been in the PubMed. And this Ayurvedic formulation, they have done the study. So this is again a very good clinical RCT based study is there, and they have done it through the Sharapunkhadi powder. So I don't find it such kind of a any Ayurvedic formulation based study which has been published on a very big platform in a such a way. Design wise, it was been completely randomized, placebo control. One is group was on the placebo and another was on the trial group, and again it was a double blind clinical trial. Sample size, they have done it into a 93 patients, one in 46 in the study group and 47 into the placebo control. Study center will be the Department of Kai Chikitsa Department, IPGT, Jamnagar. We all know aware of this institute. Phase, there was no pilot studies been done in here, but and definitely they have gone with the directly to the conventional RCT. So I will suggest again with that okay, there should be a very small pilot study on 10 patient or 20 so that it can again give the weightage to the article. And again, 12 weeks of study was there. So it is again a good study. Key ingredients, they have a three herbs in it, Sharpunkha, Bhumi Amalki, and Katugi, which is again a very potent drugs, and especially for the liver conditions. Trial drug was again a 500 mg tablet was there. So they are not going for the Kashaya format. And in placebo group, again a 500 capsule was there with this Suji powder. Coming to the action, all the drugs were having a bitter taste. Rasa possess Deepan and Pachan, we all know. So they correct the digestion. It has a Lekhan and Medo Shoshana properties. Modern view, bitter substance increase. We all that studies has shown that bitter taste increases the flow of bile and stimulate the repair of gut wall lining. Sharpunkha and Katuki have deepen property, which promotes again the digestive enzymes and prevent formation of ama in that body. Bhumi Amalki and Katuki, due to its liquor property, can remove fat and open the obstructed channels. And Sharpunkha is a rich in flavonoid, which is again a very good hepatoprotective. Now, coming to the detail in methodology, it was a double-blind, randomized, placebo-controlled trial. Objective was to see that drug over and above the lifestyle modification in NAFLD. So they have statistically done through a statistical power that on why they have taken 93 patients. They have mentioned into that, and what kind of a format they have used for randomization. They have even mentioned the website. Group A and Group B. Group A again 46 with Ayurvedic drug plus the lifestyle. Again, second one is group will be the given the placebo with the lifestyle. So they wanted to evaluate whether the Sharpunkha group was good or only the lifestyle is better or maybe efficient for the this reversal for the alcohol liver disease. Non-alcoholic fatty liver disease. Intervention was the capsule was given for 2 in a day with TID 3 times in a day with empty stomach for 8 weeks, and again with capsule with the same TID empty stomach. During the treatment, they have mentioned very important point is that patient will follow the hypoglycemic agent and antihypertensive. So it means the screening on during the screening, if the patient is diabetic or hypertensive, they have told the patient that they can even continue with that, and patients who are taking hyperlimitic medicines, so that can be stopped during the treatment. So they have mentioned such things. Now, coming to the pre-intervention, very beautiful. They have mentioned again a very good methodology that before the study, before the main drug, they have given the Mridu Virichan drug Haritiki 6 to 8 gram and into the on an empty stomach, depending on the cost of the patient, 3 to 5 days. If the patient needs 1 day, they have given to this drug to a 1 day only, or maybe it can be continued for the 3 days till the Samyak Lakshana of Kost Shuddhi. After the Kost Shuddhi only, the main trial drug will be given. So it is very good way of treating in an Ayurvedic way. Follow was 4 weeks at a gap of fortnight. During this period, no specific treatment was given to the patient. They are advised to adhere to the lifestyle modification strictly during the follow period even. Inclusion and exclusion, very detailed way they have mentioned everything in this. You can see in inclusion also like hypertension, diabetes, they have included the patients into the inclusion criteria because it is a comorbidities and NAFLD is with finally with the diabetes and hypertriglyceride condition. Indigestion, abdominal discomfort, and with that, they will screen through the USG as well as the liver function test and categorize as USG will be on like grade 1, grade 2, and grade 3. Exclusion criteria, if the patient have a fasting blood more than 200 or postprandial blood sugar, that can be even excluded. If the patient is on the drug, you can understand like this. If the patient is on drug, it is included in the study, but still if the patient is getting the blood sugar level high, they may consult to the researcher, and they might researcher can exclude or withdraw the patient from the study. That is why I think they have mentioned these lines. And other than that, generally we all mention that cardiovascular accident, myocardial infarction, and other things they have mentioned. Now, coming to the dietary and lifestyle advice, again, in a detailed way, they have mentioned what should be the diet and what should be the vyavhar, like physical exercise, brisk walking for 30 minutes in a fresh air, or either from the two things, either from physical exercise or yoga can be done. And in Ahar also, you can see that detailed way they have mentioned everything like Mudga, Yava, Patol, they should include in their diet and avoid. They should reheated and untimely food has been advised, excessively spicy, oil, salty, and everything they should exclude from. They should not follow such things. They should stop such things. Pulses like black gram, yellow gram, fish, meat preparation are again full fat milk, curd even they have recommended that should not be followed. And even sleeping time, they have told the patient as a guideline that they should not sleep in a day. Key assessment parameters. Generally, we all see that articles they mention about Aruchi, Klama, Utklesh, they have taken. Objective also, liver enzymes, lipid profile, USG grading, BMI. They have not again, as we in a previous study, we have seen that other than the USG, they have wanted to take the MR or maybe the fibroscan. So in this study, they have not mentioned it. Coming to the results, you will see the results is very good. In a good way, they have mentioned that radiologically response in this is 39%, 39.25% showed a downgrade in fatty liver disease as when we compare with the placebo, which is a 31.22. So it means both were group was significant. Means patient is on the diet and lifestyle, and other group was on the Ayurvedic treatment and the diet and lifestyle. Both the group got some good result, which is a very significant. But meanwhile, if you see the mean is very small change was there of 7%, like 39.25, and one is 31.82. But if statistically we see both were significant. Hematologically, biochemical parameters remain with the normal range before and after. There was no change they have found that hematological there was no change they have found. So statistically, there was not much change. But group B has significantly, statistically significant rise in FBS. So you can see that maybe our drug is more focused on maybe working on FBS and PBS, because in group 2 you will not see on the normal range, so they have seen some of the rise in group B. So whether it is on the on fatty liver, even on the radiologically is the same, both were get a good result. But when you see such parameters, definitely group A was working good. And serum protein has a significant rise in both the groups. So maybe I don't know what was the reason. They have not mentioned the reason, but both the groups got some way of got the increase in protein. In all other parameters have an insignificant change. So they have mentioned very beautifully that both the groups have not changed anything significantly. Subjective relief, yes, it is why I'm mentioning is that group A got a very good on a subjective parameter as 70 to 80% relief from Aruchi, 77.48% in Klama, as compared to placebo, where there was only 40% relief. So you can see that our drug is working more on a subjective, individualized, and symptoms kind of action. Next was abdominal pain. You will see that 73% got a good result in abdominal pain as compared to the placebo group. Burning sensation, again, somewhere it's around. Abdominal heaviness, yes, 80% got a good result as compared to B group. Abdominal distension got a very good result, 78.89% as compared to B group. Constipation also, you can see it's a very good result because it contains Haritki, it contains very good Bhedana drugs. So group A got 67.69 as compared where B group got only 18%. So coming to the again, we are sitting here for the critical analysis as the article was very good. Still, we should discuss about the critical analysis. Pre-treatment factor was very good. It's a strength kind of a thing that both the groups got a Haritki. So by that Haritki can be a very good thing when we try to study such kind of a studies for whenever we got the chance to study on fatty liver disease. So we should go with the pre-treatment with the Haritki or any kind of Shodhana drugs we can use because it will again might be full potency of the study drug, maybe giving a good result in that. Formulation strength wise, yes, good. They are very good. Bhedana they have selected like Kutki, and it is very good Lekhana agent and Rasabodhana, which stimulates the biliary secretions. Critically, I want to say is it raises the question about the dose standardization. That is why I've wanted to tell you that they have why they have not done the pilot study. In the pilot study, they can come with the standard drug dosage for this formulation and the patient compliance due to the bitter taste, but they have not mentioned whether the patient got the compliance or not because does dose tasting the bitter herb provide better result than swallowing a tablet or not. So they wanted to, in a discussion part, they can mention that some of the patient got bitter taste and they are okay with that, or maybe they don't want to take the bitter taste. So in the future, we can somewhere we can hide that taste with the including of other honey or something like that, so that patient got a good result efficiency wise when it is a taste wise condition is there. Lifestyle confounder, yes, there was a very mild result was seen as a 8% in both the groups. So placebo group is 31% improvement. And this proves that even from when we see from the Ayurvedic point of view, Ayurvedic lifestyle modification can also work like very good in this condition. So in this study also, it proves that even from it is not taking an Ayurvedic drug, but it is following the patient is following the Ayurvedic way of lifestyle. So definitely got a good result as compared like it is as equal to the drug of A group. So this the medicine provides an extra 80%. In other way, you can see that yes, there was a very mild difference, but 8% also and an extra effect might be because of the herb. Blinding integrity, was the placebo successful in Ayurveda trial, matching the bitter taste of herbs like is nearly impossible. So unblinding might be they have should focus, they should have discussed about whether that was unblinding or not. USD limitation, USD is subjective, as already we have discussed that fibroscan or other parameters should be included because it give a very good standard standard way. It's a gold standard to evaluate the drug. The study focused on early to end mid stage also. It exclude the grade 3 and cirrhosis. So therefore, practitioners should cautious about exploiting these results to the end stage liver disease. So in this result, yes, the drug is very good for grade 1 and grade 2. For grade 3, we'll be waiting for the good results of any Ayurvedic articles. If it comes, it again gives a boost for the any practitioner that yes, there are drugs for grade 3 also. Lifestyle modification alone is highly effective in early stage. The Sharapunkhadi group demonstrate that Ayurveda provides the acceleratory recovery when we add the Ayurvedic drug and cellular protection that lifestyle alone cannot achieve. So if you can see the subjective parameter, we are good into that. That group got a very good result when you include the Ayurvedic herb with the lifestyle. They have mentioned the limitation also that sample size was very through significant, they are very small, and largest multi-center trial is needed to generalize the results. US is subjective. Yes, they have mentioned it very beautifully. That's yes, that there should be a fibroscan would be a better objective tool. Summary of the findings. Yes, we got that Sharapunkhadi churn is very effective because of the bioaccelerator in the lifestyle changes. If we go with the long subjective parameter, good results in Ayurveda intervention group. It is a particularly potent in reducing the serum triglyceride and liver enzymes. As we see the results, they're very good in reducing these parameters. Clinical protocol of 3D Haritki, as I've told that it's again a very good game changing that it's a very good way of treating and increasing the potency of Ayurvedic herb that we should start with the pre-treatment, and it gives the validated evidence-based approach for grade 1 and grade 2 also. So when you are planning for grade 1 grade 2, start with the Haritki, Gosh Shodhar, and then give to the any of the Ayurvedic treatment. Now, third one is the very latest study, and 2025 only it has been done with the PMC. It is on an Ayurvedic way of treating, but on anything which is not mentioned, anything about the Ayurveda, but they have taken the Bhumi Amalki with in this particular study, and the stage was non-alcoholic steatohepatitis. Again, it is an advanced stage of a liver they have taken, and in phase 2 it was been done on a phase 2 trial, clinical trial. It was multi-centered, randomized, double-blind, placebo-controlled. They have mentioned the placebo. So it is again a good study. So I've just go through very small way. So it is published in PMC, BMC Complementary Medicine, which is a very good journal. And design was phase 2 kind of a study because the patient sample size was 93, and in 46 it was in study group and 47 in the placebo group. Sorry, it was been again, I thought it is repeated of any other slide, so just don't follow on this slide. Now coming to the methodology, the primary objective was to assess the efficacy as well as the safety of the combination of 200 mg they have taken of Bhumi Amalki and 100 mg of Silybum marinum. It's again a herbal drug, and they have given the name as Heptex, and they have made a tablet out of these two drugs. Sample size and intervention, they have done it on the 167 patient. They have screened it and got from that 167, they got a 146 patient, and which they again randomized in 3 groups. And group A, they got a placebo. In group B, they give a low doses of above this formulation. And group C, they have given the high dose. So just see the methodology they have followed. It's a very good way of your writing your if you are planning for an article. So this is the way we should all follow, and how the screening was done, enrolled, randomized been done, and allocation was how the allocation was been done, and how they have follow-up. So they have done the follow-up, and analysis also been mentioned that on group A, group B, and group C, how they have done this this parameters for analysis. Coming to the inclusion exclusion, again, they have mentioned everything which we have seen also in the previous study. So completely same way they have mentioned everything. But they have mentioned few things more, that kidney abnormalities. They have mentioned the level also. If this more than 1.5 only, they will exclude it. Drug induced liver injury, if there, they will exclude it. Autoimmune liver disease will be there, so they will remove it. Liver cancer plus serum alpha fetoprotein. If somebody, they will go with the this test. If it having 100, more than 100 ng per ml microgram, so they will exclude completely from the study. And plus, they have mentioned the drugs also, like thiazolidinodions. If something the patient is getting, the drugs knows to induce liver cirrhosis, so they want to see if the patient is taking this medicine or not. So if that is there, they will exclude it. And withdrawal property, also withdrawal way of patient was also been mentioned, but not in a detailed way. But they have mentioned that the patient will be completely voluntarily can withdraw from the study. Additionally, even the investigator, if they feel that patient is not following the drug, is not missing the drugs, is not following any guidelines, so even investigator can also discontinue the patient from the study. Coming to the results, it's very beautifully they have mentioned everything, and in which I wanted to highlight is that they very good way of that they have mentioned that there is a difference, but statistically there was no significant difference they have found with liver enzymes after the 30 week of the treatment. So there's we need a big heart for writing such things, that in my study I don't get any significant result. And most of the studies what we see, that I have mentioned the first study, they have mentioned everything like highly significant on all the parameters. So we should learn from these things, that genuinely, and that if you are getting bad result also, you should mention in a same way. In a fast score, they have gone through the very other than the liver enzymes, they have gone through a fast score test also. There was a criteria. They have seen CAP tests, KPA, FIB, they also mentioned, and they found no significant change. And even in the lipid profile, they have not seen any change. They have seen the change, but they have not significantly changed when compared with the control group. So conclusion by the author only, he has mentioned that results of the current studies suggest that Haptex is a safe and well tolerated for the 36 weeks. However, we could not conclude that drug efficacy as the current study could be limited by its small size. They have mentioned maybe because of the small size. And in addition, depending only on non-invasive sonography and hematological tests is considered a limitation of the study. Along with that, according to assessing the histological findings, direct antioxidant activity may reveal more promising effect of this combination. So they are suggesting that if you are going with the same, you should also include antioxidant activity test also in the patient. Now, conclusion and takeaway for the practitioners. I hope you are all way listening, and so I conclude it here like that these protocols are just not just because about the testing a drug. We have learned that it is about testing a system of medicine against the standard of care using the highest tool of science. So I have tried to mention everything on a different articles way, so that we can learn that what author is doing and what latest things are going on. So these studies provide the promising clinical efficacy in NAFLD management. If you go for Sharapunkhadi powder study, so we have seen the remarkable improvement in that. Subjective parameters in the modern side, which I have mentioned previous study, they have mentioned they are not focusing on subjective parameters, whether the patient is getting abdominal pain or not, clama, such kind of they have not mentioned. So it gives this opportunity for the practitioners that we should follow such things, and on a very good journals, on very good standards, we should include such things as a Ayurvedic way. So people will get to learn that Ayurveda is also not only LFT, which is a good thing, but we also focus on personal approach and personalized patients' symptoms and other things. Pre-intervention, which is again wanted to say the takeaway that always initiate 3 to 5 days for Deepan Pachan always. And with the Mridu Virechan drugs like Haritiki or Aravad to clear the srotas, and it will definitely enhance the bioavailability of the any of the Ayurvedic drug you want to study. Standardized Ghan Vati ensure a concentrated delivery of the principles means when you are going for the instead of a kashai, if you are going for the tablet form, it will again give a very good of delivery the principles like tiktarasa directly to the stomach instead of chun, which has a very low patent compliance in NFLD, because we all know that kashaya taste might be the patient may be missing because of the taste. He might not following properly, and sometimes patient even withdraw himself from the study because they don't like the tiktarasa taste. Next is lifestyle modification is a foundation. So that is why we got a very good result alone in the group. But Ayurvedic guidelines provide the therapeutic edge also. We see the some of the good result, whether it is 8%, and even we see in a study where they got a very good on subjective parameters. And plus is need for longer follow-up. There we takeaways that we whenever we follow when we are planning for the study, we should add a longer follow-up to at least for 6 months. Future trial must incorporate fibroscan or lipidomics for global acceptance. Using ALT and ASD may not be optical because it is not optical. We have seen that many of the studies have not gone a very good results in ALT and ASD significantly. They might have got some reduction, but when we go for the fibroscan, it gives give the more weightage to the study. And on an international standards also, people will follow that. Yes, they have done it very because we all be, the doctors always been cursed for that they are not following the good methodology and they are not published in a good journal. They are not doing a very good gold standard RCT. So they we definitely lack from those parts. So we should plan and most more specific tests are needed to further investigate. If you are planning for further study, you should also we can also add like lipid metabolisms such as liver biopsy can be done. APO, APOB and APOAI ratio can also be done, and lipoprotein should also be included when you are planning for study. At the last, the strength of our Shastra lies in the holistic nature, but the strength of our practice lie in our ability to prove it through the lens of modern science. This protocol proves that our medicines are not just supplements, they are potent metabolic regulators. At last, our India patients are unique. We are in the first slide only I mentioned that India statistically where they are saying that they are suffering from lean NFLD, where traditional weight loss it's not only the answer. So we should must include Ayurveda broadly and individually and to target Agni and Dhatu Agni to correct the metabolic signaling in the liver. And instant, I have done with my all the articles, but this article is just a few days back, and they have mentioned about this NAFLD only. So we'll see what they have. I have recently on my in LinkedIn also I have posted about this study. So liver fat disease or misunderstood. The author has changed the mind of us. What they have told is in this study is that did you know having fat in your liver is not always a liver disease? So it is again shocking for me to read this article. Labeling millions of people with simple steatosis is having liver disease is wrong. So saying that people are having steatosis, it doesn't mean that everybody is getting a liver disease. Liver disease main word is liver disease, nothing liver disease, but it is a NASH kind of or fibrosis or cirrhosis. Then only we call it as a liver disease. So liver, but fatty liver, it's not a disease. A new expert opinion shows that simple fat accumulate does not equal illness in most cases. It is often a marker of metabolic risk like diabetes, obesity, not a disease itself. Because maybe getting the metabolic fatty liver, maybe because of the diabetes, not as an individual you are getting the fatty liver. But due to diabetes or obesity, you are getting this disease condition. Hepatologically has become overly focused on hepatic steatosis, fat in the liver. So hepatologically, they are more focused on this hepatic stenosis. Everybody is getting fatty liver, so they are wanted to drugs. They have introduced the recent drugs also coming. While the real clinical problem is liver fibrosis. Clinically meaningful liver disease begins when fibrosis develop. When it comes to the second stage, then only it is very dangerous. If it is the first stage, definitely we should follow the preventive way. And Ayurveda plays a very good role in that condition. What really matters is whether this fat triggers inflammation or scarring. That's when it becomes a true liver condition that needs treatment. If we follow that when it comes to the second stage only, then the modern scientists should focus on. So the author want to say is that whenever there is a liver fatty liver, you should not only focusing on drugs that should be given for first stage. Creating unnecessary anxiety, over medicalization, misuse of healthcare resources is wrong. So key takeaways: take fatty liver common but usually benign. Real worries when it progresses to fibrosis. Better taste, test, and precise diagnosis are key. Let's focus on what actually impacts your health, not just what looks abnormal in a scan. So thank you so much for and thank you for me to listen. I was been interrupted many times during my presentation even. So thank you for be on that here only to
Thank you
listen.
so much, Dr. Ravi. It was really a nice presentation, and we also know that our GCAR's mission is to educate, encourage, and facilitate basic clinical and interdisciplinary research in Ayurveda. And so, is our vision is to promote and establish Ayurveda as an evidence-based health science globally. And you have done a very good job with the articles you have presented, and I mean, I agree, like in the first article where there was like Phalatrikadi Quad. So Phalatrikadi Quad, it has been used in many of the liver disorders earlier also, and so many researches also have been published. And in Ayurvedic practices, like regularly we give our patient this is a liver potent drug. So they could have used the facts earlier and stated in the article how effective and potential it is. Instead, like they use just like the mention of it, and then also like in that research, they didn't use another arm because we have to have a comparison arm also to find out whether it was effective or not. Um, it was a brushing up for me also, like learning about again everything refreshing. So thank you so much, Dr. Ravi, and I really learned a lot. And I'm hopeful like the people who will be watching this slide, because most of them have that concept of having people who are like alcoholic have the fatty liver disease. Like general layman people, they don't know that there is something called as non-alcoholic fatty liver disease as well. So where they have to take care of things you have mentioned in the slide. And thank you so much for the vision you have given and for the insight you have given. And I'm hopeful like for your upcoming research we have further success. And
Yes, you can go for a Google search. I have done few of the articles, not as RCTs because I am very on a very small institute, but I have
then
done single cases. I have published two, three articles on a very good journal. Even one is on the PubMed also. So
mm-hmm.
I'm trying my best what I can do with the limited resources.
No, no, you're
But I
doing,
love researches. I
yeah.
learn
And
a lot from the recent articles, and I am on the LinkedIn also. You can see
I'll
that my
follow you.
post recently started my LinkedIn from last 1 year only. And not focus on evidence-based Ayurveda and wanted to publish and aware the people about the what is going on a research industry.
Mm-hmm. Thank you
Thank you
so
so much
much.
for
And
giving me that
in future,
opportunity.
if you ever want to come back, we always welcome, because the way
Sure,
you
ma'am. Sure. Thank
presented
you
the
so
technical
much.
analysis you have
It
given.
means a lot that you are again wanted to invite me. It
No,
means a
no.
lot for me.
Thank you for your
Thank you so
time and
much.
thank you for the work you have done. Thank you so much.
Thank you so much, ma'am. Thank you.